Everyone's talking about red flags. So let's talk about it. Now, social media has brought to the forefront a couple of truths. One, dating is hard and it's probably just trash. Two, there are certain green, yellow, and red flags that will come up in the course of a relationship. And those should dictate how you move in that relationship. And I would say that the relationship that you have with your plastic surgeon is pretty up there and pretty important, especially within the first year of your surgery. So let's talk about how to spot the red flags with your plastic surgeon. One, you need to make sure that your surgeon is a plastic surgeon, not a cosmetic surgeon, not a trained general surgeon doing cosmetic surgery on the side, not a trained ophthalmologist, ear, nose, and throat doctor, but an actual plastic surgeon. And that means that that person spent years, not months, not a weekend course in Maui, but years. I don't know why Maui's getting it straight right now. I love Maui. But years training in plastic surgery. There are many ways to become a plastic surgeon. So your surgeon may have done general surgery and be fully trained in general surgery, but then also did residency in plastic surgery. Your surgeon may have done ear, nose, and throat and also did plastic surgery and also did plastic surgery and also did plastic surgery. Do you get it now? Even if your surgeon didn't start out as a true plastic surgeon, they ended up doing years of training in plastic surgery in order to be credentialed properly and trained properly to perform the procedure that you want. They are not a dermatologist. They are not a cosmetic medicine doctor, whatever that is. They are truly, I'm throwing all kinds of shade, but truly, and I still fought in order to be able to throw this shade properly, truly a plastic surgeon. The other thing is that they are actually credentialed to be a board certified plastic surgeon. This is very easy to look up if you're in the States. You literally go to abplasticsurgery.org and you can ask the board, is my surgeon board certified? In other countries, it might be a little bit harder to figure that out, but it is absolutely your right and your responsibility to yourself and your health to find that information. Number two, ask yourself, before you walked in to see your plastic surgeon, how long did you wait in the waiting room? And how easy was it to make that first appointment? Now, don't get me wrong. Waiting in the waiting room for a doctor for an hour is commonplace, right? And it's not that big of a deal. But the only true predictor of future behavior is past behavior, right? And so imagine sitting in the waiting room for an hour when you have drains in, you have a head wrap, you're in pain, and maybe a little nauseous for your post-op day to follow up with the doctor. Imagine if you had to call 3 or 4 times to get an initial appointment or consultation, that you are then having a drain in, have a head wrap on, are in pain and a little bit nauseous, and maybe a little bit dizzy, you have some bleeding, and you're trying to get a hold of your doctor, and it takes you 3, 4, 5 tries, and even then you don't get a call back. Yes, 911 is always available. However, you paid this person how many $1,000s? So they should be fully accessible to you. You should not have to wait long in the waiting room, and you should not have to call several times before you get a response from a staff member. Number 3, so now you're in the consultation, and the surgeon is making unrealistic promises or guarantees and telling you that everything that you want is what they can deliver, exactly the way that you want it. Exactly per the picture, inspirational picture that you brought with you from Instagram. That's exactly what they're gonna do for you. Your response should be, are you broke? Because a surgeon who makes unrealistic promises, does not set limitations, boundaries, or expectations properly and says to you, I guarantee you a great result, or I guarantee you this TikTok inspired result, is looking to get your money. Because there is no guarantee in surgery, there is no risk-free surgery. This is all a balance of risks and benefits. And furthermore, if you bring me 20 pictures of 20 women, right, what will always be true is that those 20 women healed differently, and there's really not one unifying thing about their result. They had a great result for them. That's actually it. And so surgeons, a realistic surgeon will tell you, I want to do this for you. I think I'm capable of doing this for you. But you have to realize that you will heal differently. There may be complications. There are risks involved. It is surgery after all. If you don't hear that kind of message from your plastic surgeon, then it's a red flag. Not a yellow flag. It's not a green flag. It's a red flag. And again, if they make the guarantee, they are either greedy or broke. And so literally you should leave there and be like, brokey, please. Okay? Whatever number this is. You're still in that consultation and the surgeon says to you, you may have come to me for your eyes, but here's what I see. And I want to sell you on a complete facelift, laser, fat filler, everything. And while we're at it, let's do the breasts and the body too. That is a used car salesman. That is not a plastic surgeon. Now, here's where it's a little nuanced and a little tricky, right? Because I have a lot of patients who say, my goal is to look rejuvenated and I want just my eyes done. And they come in and they have bad jowls. Their cheeks are hollowed out. You see wrinkles everywhere. The skin looks a mess, right? And I think as a surgeon, girl, there's more, right? And so I will say, I do see that. And I will also say, here's everything else that I see. Ultimately, I don't want to upsell you. And I literally say to people, I am not a used car salesman here to sell you on more. But I do think that if your goal is facial rejuvenation, you have to think about what those other things are. Because I'm not sure that just doing your eyes is going to be enough. And I've had people who have said to me, I hear what you're saying, but I just want to do my eyes. And we leave it at that, right? But my goal is not to sell you on anything. My goal is to try to figure out what your goals are and then try to get you there as closely as I can. Because the last thing I want is we get your eyes done, they look gorgeous, but again, they're in a canvas of horrible skin from years of sunbathing, jowls, hollowed out. And then you're like, well, I hate my eyes. And really it's like, girl, that's what I want to avoid, right? But again, if your surgeon is a car salesman and wants to upsell you on everything, that is a red flag. Absolutely. But again, it's a very fine line, and a good surgeon will walk that fine line with you to ultimately make you feel comfortable about what you choose and maybe have you thinking more realistically about what you're going to get in the end, right? Because if I fix your eyes and everything else still looks the way that it looked before, then I want you to literally see your eyes just like this, right? And put everything else into context. And you can say, I love my eyes. And maybe nothing else is perfect, but this is who I am. Fair? Number 4 or 5? 5? Let's go with 5. Your consultation feels rushed. So I recently did a React where a guy said that his surgeon walked in with his powder bag, dropped it, made some marks on his chest, and then walked out, right? So it's very clear that or what it sounded like to me was that his consultation felt rushed and that he felt maybe a little bit dismissed. Surprisingly, he still went forward with that plastic surgeon because that plastic surgeon was a popular plastic surgeon and was well recommended. They could be the best plastic surgeon in the world that comes with all the glowing reviews in the world. But this is a one-on-one relationship, right? And what may work for someone else, or the relationship that that plastic surgeon had with someone else, is not the same relationship that that plastic surgeon is having with you, right? I have different relationships with different patients. Some I like a little bit more, some I like a little bit less. I'm still professional with all of them, but you might get a little friendlier response and a little, slightly friendlier me, and a less like, oh, okay, I'm just smiling because you're here, right? Based on who the patient is and whether or not I vibe with them, right? It is a vibe. It's all a vibe. Let me tell you, from this end, it's a vibe. So if the vibe is off, I sometimes leave being like, she's not gonna book with me because that vibe is not vibing. Right? And then to my surprise, they're like, I want you. And I'm like, I got you, girl. But really, you should not feel rushed. You should not feel dismissed. You should feel like your questions were answered, and you should feel encouraged. And that brings me to number 6. You didn't leave feeling encouraged. You left feeling either blah or slightly disappointed, right? Just listen to your gut at that point, because blah or slightly disappointed should never be feelings that you feel when you're about to commit tens of thousands of dollars or about to submit your life into someone's hands. That should not be the feeling that you feel. This one gets me every time, and I think this is more popular in basically what I think are plastic surgery factories. And that is, you didn't meet your surgeon at your consultation, and there is no plan for you to meet your surgeon until the day of surgery. That's not okay, okay? Now, it may be that the office has a physician assistant or nurse practitioner who meets you that first day and goes through all the things about surgery, and then you get a quote. But there should be a time when you meet your surgeon before the day of surgery, not the day of surgery, but before the day of surgery. Because again, it is a one-on-one relationship. And that PA or that MP is not gonna be the one actually operating on you. And if they are, see point 1, right? So you really need to make sure that you are not at a factory and that you are actually going to establish a rapport with your surgeon. I keep losing track of what number I'm at, but this is the next one. Obviously, if your surgeon has a negative reputation, that also seems pretty basic. I don't mean that the surgeon has bad Real Self or Yelp reviews, because the negative reviews, people only really write reviews when they feel super, super excited and motivated, or when they feel really, 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 really dismissed, disregarded, put in danger, what have you, right? So the two ends of the spectrum exist, and usually most people are not writing when they're in the middle or slightly above middle, right? So I don't know that Yelp or Real Self truly capture everything that a person can experience or has experienced with a particular surgeon. So I wouldn't rely on that either way, whether it's super positive, super negative, or everything in between. What I would do is, at least get a 4-star surgeon, right? We at least aspire to a 4-star hotel. So a 4-star surgeon seems reasonable to me. Now, the other thing I would do is, you can ask also if you can speak to patients who are open to it, to speaking to you about their experience. That's not something that should be hidden. Now, HIPAA is a thing, right? We want to respect people's privacy, patients' privacy. But the office can call the patient and say, hey, are you willing to speak with another patient? And that's okay, right? So this is not like you must do this because you will not be guaranteed a great surgeon if you don't do this. But this is like, if they have a negative reputation, do not pass go, right? But if you're like a little iffy about where they stand with their patients, ask them, is it okay if I talk to one of your patients who's had surgery recently? And of course they're gonna pick a patient who had a great result, had a great experience. That's true. You can't get around that. So again, it's truly your gut reaction, your gestalt. But obviously, if you've only ever seen 1-star reviews, then it's a question mark. And last but not least, number 10, the office or the facility that the person uses feels a little dingy. And I don't mean antiquated, right? Sometimes there are surgeons that I know and you go into their office and it looks like the 80s spat up in their office. I do not mean antiquated. I mean dingy. You go in and you're like, this doesn't look as clean as I think it should be, right? And if that's the case, don't do it, girl. It's not worth it. You can ask, that being said, you can ask, hey, what facility OR do you use? And are they properly credentialed, right? And you too can look that up. So, maybe the office is a little dated and a little dusty, but when it comes to the OR, the surgeon is in a quad A surgery center. So that's reasonable to ask for that information. But if you left feeling like, oh, this is a little dirty, then you probably shouldn't have your belly open in that in that kind of environment. What questions and comments do you have for me? I've said a lot. Leave them below. Like and subscribe. Heart. All the facial expressions. As always, love you lots and bye for now.